Mr. Medellin here, you guys, Mr. M, and we were asked to do some videos on ribs. So we're going to do two separate videos. The first one's going to be on the upper ribs. So we'll do upper ribs above diaphragm, and we'll do anterior, posterior, and axillary rib injury. So I'll explain the difference to you, and I'll tell you exactly what projections to do. These are one of the projections that people don't like to do, the ribs. Okay, but who doesn't like ribs, right? So let's go ahead and get started. All right. We're going to go ahead and get started here with positioning. So we have our patient, we have our 14 by 17. This is our flat panel detector. It's going to go lengthwise. All right, and I'm going to put it to about 1.5 inches above his shoulders just to get started. We're going to be doing it at 40 inches SID. So we'll do that here. And collimation is 14 by 17. And if you're working with centimeters, it's going to be 14 inches will be 35 centimeters, 17 inches will be 43, so it'll be 35 by 43. Okay, so let's go ahead and get that set here. So we're at 35 and 43, we're at a 14 by 17 field right now. So again, it doesn't look that big, but remember the beam diverges, so it's going to go ahead and get what we need in here. So what we're going to have you do is have our patient put their back against the board right over here. All right, so we're doing upper ribs. This is above the diaphragm. So on your technique charts, it might say AD for above diaphragm. If you're doing ribs below the diaphragm, it'll say BD, all right, if you ever look at the technique charts. So we're going to start here. We'll do the right ribs, and then we'll do the left ribs. So I'll do them separate for you guys, okay? So if the patient had a posterior rib injury, you're putting the back against the board. So your projection is going to be AP. Again, so we're doing posterior rib injuries. Remember, you want to keep the site of interest closest to the IR when it comes to ribs, right? So if the site of injury is on the posterior side, you try to get the posterior side closer to the IR, all right? So I got here, you guys, I want to make sure I'm at the level of T7. So I have here, I'm going to come down just a little bit like a hair. Watch it back here, sir. Do that. Do this here. All right. And I want it in the mid-sternum. So here's his jugular notch. Here's his sternum. I can see that right there, you guys. So again, we're mid-sternum. This is the level of T7. So what we're going to do is we're going to do unilateral ribs. So again, I'll put it in the comments section as well. I'll put down exactly what you're going to be doing for the area of interest, okay? So we're going to have them slide over a little bit. We're going to be doing unilateral. All right, so we're doing half of the half. Here's his sternum, here's his rib cage. So now we're just going to abduct this arm a little bit here, just like that. Just abduct it out of the way. I got my right marker here. I'll put my right marker just on top of that shoulder right there. So this is going to be an AP, right unilateral, for the right posterior rib. All right, so again, I'm doing an AP, right unilateral, for the right posterior rib. So again, we're going to have the patient, I have the technique set. I have it set at 12.5 mass at 74 kV. He's pretty thin, so I probably would go down to maybe about 10 mass at about 74 kV. All right. So now, since it's above the diaphragm, I want the diaphragm to go down to its lowest position, so I can get as many upper ribs as I can. All right. So we always want to shield the patient. So if I can have a shield, I just saw that too as well. Thank you. All right. So. Can't forget about this. Let's put this around your waist. Meet me around the corner. All right. Make sure it's a little tight, just like that. All right. So, and these things happen again, you guys. So, you know, it's an easy fix. He's not too far in the position that we have him. So if you want the diaphragm to move down to its lowest position, how do we get him to breathe? What do we have to do to get him to breathe so that the diaphragm comes down? Do you guys remember? Do we do it on expiration or do we do it on inspiration? It's going to be on inspiration. So you want the diaphragm to go down, and that's why we're doing it erect, because gravity is going to pull that diaphragm down further. So we're going to have you breathe in, sir, let it out, breathe in again, and hold it. Stay just like that. All right, so I'm going to move the marker up just a little bit. Stay just like that. Don't move. I go ahead and shoot that X-ray. Beep. All right, you go ahead and breathe and relax. All right, so now we just did an AP, right unilateral. So now we're going to do an oblique. So in the field, we have the obliques. We have a term for the obliques, and we say post is close. So if he has a posterior rib injury, you want to turn to where the site of entry is closest to the IR. So we're going to do an RPO, just like this here. Now, which arm do you get out of the way? Whatever the site of interest is, that's the arm that you have to bring up. So we're going to bring this arm up, right? And I'm going to bring him over here. Just come over. There you go, right there. And again, we're not going to get maybe all the ribs in there. He's pretty thin. We're going to come forward a little bit right there. And do you see this line? You want that line coming down the jugular notch. We're still at the level of T7, right? But we're going to go ahead and do an RPO to demonstrate the right posterior rib injury. If he had an axillary rib injury, you're going to do posterior obliques. So the RPO will be good for posterior rib injuries or axillary rib injuries, the ones that come along the side of the ribs. So now we're going to have them again. I have the technique set at about 14, 15 mass. We're doing a little bit bigger body part now because it's turned at an angle. I'm going to have you go ahead and take a deep breath in, let out, take another deep breath in, and hold it, just like that. Okay, x-ray clear, beep, and this is going to be for the right posterior ribs, right? You can relax and breathe, all right? Now we're going to go ahead and transition into the left posterior rib injury, okay? So I'm just going to go ahead and have him put his back against the board here again. Slide over to your right. You're going to bring this arm up, just kind of bend it a little bit. And again, you want half of the half. So I'm going to put my left marker over here. So now we're going to place this left marker over here just on that top shoulder. And again, this is for the left posterior rib injury. So again, you're trying to get the site of interest closest to the board. So I just kind of abducted the arm a little bit. Again, here is his sternum. His axillary rib border is here. So we want to go in between those 2 points. We're at the level of T7. Again, this is above diaphragm for the left posterior rib injury. So now I'm going to have the technique set at 10 mass at 74 kV. I'm going to have you breathe in and let it out. Breathe in again and hold it again. Keep it just like that. I want the diaphragm to go down. I want to get as many upper ribs as I can. Go ahead and breathe and relax. All right, so now we're going to go ahead and do an LPO, left posterior oblique. So we're going to turn at an angle here. You're going to raise this arm up. Okay. I'm going to put this left marker right over here. Again, we're rotating the patient at 45-degree angle. All right. I want that line to come down here, and we're focused on the left posterior ribs. So he's at an oblique position here. He's at 45 degrees. I got the technique set at 12.5 mass to maybe 15 mass, if that. And we got about 74 kV. All right. So again, I'm going to have you breathe in. You're going to let it out. You're going to breathe in again, and you're going to hold it. All right, x-ray cleared, beep. Okay, you can relax. Now again, if this was an axillary rib injury, you can do an LPO as well. So again, LPO, left posterior oblique positions, can be used if you had a left posterior rib injury or you had a left axillary border rib injury. All right, so we usually do posterior obliques. All right, so now what we're going to do is we're going to pretend he has an anterior rib injury. So we're going to have you turn and face the board. We're going to have you put that shield on your back. Just kind of turn it. There you go. All right, so I got my right marker here. I got my left marker here. All right, so now I just got to remember that he's turned in a PA. So now, here's where it gets a little funky, okay? You still want to try to keep the part closest to the IR. But when it comes to the obliques, we're going to have to turn them to where the spine's not going to be in the way. So this is where people get a little confused, but I'm going to try to keep it as simple as I can. So let's see, he has a right anterior rib injury. All right, so again, I want to try to get his spine here. Here's his axillary border. I'm going to abduct this arm just a little bit, just to get out of the way. All right, so I'm going to bring this over just like that. So again, here's his spine right here. Here's the axillary border. I want to try to get it in the middle. So I'm going to move him right there. There we go. Perfect. So now I'm going to flip my marker over. I have my right marker here. I'm going to put it down here just like this. Okay, and of course, it's not sticky anymore because I was messing with my markers. So let me put some tape on it if I can. All right. Oh, we got a marker right here. Thank you. We have markers that just appear out of nowhere. That's okay. Look at that. All right, magic. X-ray is magical. You guys got to remember that. Okay. So I got the right side here. I got the marker PA because he's PA. because when you look at it in anatomical position, the marker will be facing you. I just like that, just a little bit better. All right, so now again, we're gonna be doing it above diaphragm, so we wanna have the patient do inspiration. So we're gonna have you breathe in, let it out, breathe in again, and hold it. X-ray clear, beep. All right, so now watch this. You can relax and breathe. This is where it gets a little funky. So remember that posterior obliques, we said you want the side of the injury closest to the board, correct? But when it comes to anterior obliques, A is away. Okay, so this pertains to ribs and lungs. So now we're gonna turn him at an angle, 45 degrees. We're doing a left anterior oblique for the right side of his ribs. We want the spine to come away from the rib injury. So if we were to go ahead and turn him this way, look what's happening. The spine will be superimposed over the right anterior ribs. So again, we're gonna turn him into an LEO position so that we can get the anterior ribs, and the spine is gonna come away from the area of the rib injury. So we're gonna place this arm on top of your head. All right, there we go, just like that. I like to keep it simple. Here's the inferior angle of scapula. I like to put the central ray here. But if you look at it from what the textbook says, it says to place the central ray midline between the vertebral column and the elevated axillary border, which is here. All right, so again, I'm gonna put this marker down. Let's see if I can move here. I see some light right over here on the bottom. I just put the marker here. All right, so what we did was we placed the marker here. This is still PA. It's the right side. It is the elevated side. So again, we're doing an LEO for the right anterior ribs. So I just placed the marker right over here. All right, and there we have it. So now we're gonna have the patient breathe in, let it out, have the patient breathe in again, and hold it X-ray clear, beep. All right, technical factors were the same as we did for the posterior ribs. We have it about 15 mass at about 74 kV. All right, so now we're gonna do an REO. So we did the LEO, now we're gonna turn them into a right anterior oblique position. Again, you're doing the REO for the left anterior ribs. So again, you're doing the side that's away. The side of interest is furthest from the IR. We're gonna raise this hand up, just like that, there we go. I wanna try to get the central ray here. All right, so look at that. That's pretty close. Look at that. That's pretty good, huh? All right, so we got lucky right there. All right, so this arm we're gonna bend just out of the way a little bit. And again, you have the spine and you have the elevated side. You wanna try to get that beam right on the inferior angle of the scapula. I'm gonna put my left marker face down, PA on the left side here. So now, right there. Let's see where I'm at. I place it right over here. All right, so I place my left marker up here towards the top portion. I might get it in the humerus a little bit, but at least I'm not gonna get it in the ribs because I don't see any light on this side. There we go. You know what, let's keep it right there. So I think I'm good right here. There we go. All right, so again, we got right here on the inferior angle of the scapula. I'm gonna put my left marker right over here. Let's see, I'm just gonna push it just a little bit right there. There you go. I know it's just off just a hair, but I'm gonna put my left marker here, and now we're ready to shoot this. So again, this is the right anterior oblique to demonstrate the left anterior ribs. All right, so again, we're doing an REO, a PA oblique projection, a right anterior oblique position to demonstrate the left anterior ribs. I'll make sure I put information in the comments so that you can use that as well. But again, you guys, this is gonna be your rib, your rib exam. So this is for above diaphragm. What we did today was above diaphragm for anterior, posterior, and axillary rib injuries. I'm hoping this will help you. We'll do a separate video, you guys, for the lower ribs as well, okay? All right, so I'm hoping this is gonna help you. Thank you for the request for this video. Take care. Hello everyone, you guys. Thank you very much for watching the videos. I'm hoping that they're helping you out. Please make sure that you subscribe and that you hit the notification bell to be notified about new videos. Again, remember to be good to yourself and be good to others. Thank you.